Modern medicine is wild in the best way. But if you rewind the clock, medicine was not just painful, it was chaotic. Today, we're counting down 5 creepy, outdated medical procedures that were genuinely used on real humans. All right, let's dive right in. Number 5, surgery without anesthesia. For most of human history, there was no reliable way to block pain during surgery. No general anesthesia, no local anesthetic, no epidural, meaning if you needed an amputation, a tumor removed, or a deep wound explored, you were going to feel it, all of it. So what did doctors do? They tried the only options they had: alcohol, opium, herbal sedatives, and if all else failed, brutal force. Patients were often given massive amounts of whiskey, wine, or beer in hope that intoxication would dull the pain. And if you weren't knocked out, they restrained you. Assistants, staff, family members, whoever was nearby would physically hold patients down while the surgeon worked as fast as humanly possible. And that's why historical surgeons were praised not for gentleness, but for speed. Compared to back then though, medicine has come a long way. Pain isn't just unpleasant. In fact, severe pain triggers a full body stress response. Even if the surgery technically went well by their back then standards, the body might not survive the physiological chaos of pain. And psychologically, a lot of patients were left with what we now recognize as trauma responses, nightmares, panic, and avoidance of medical care for the rest of their lives because they remembered the agony. Lucky for us, that's when everything changed in the mid-1800s with the first public demonstrations of ether anesthesia. For the first time, surgeons could operate on an unconscious patient, and the anesthesia didn't just reduce suffering, it transformed what surgery could even be. Number 4, boiling oil for wounds. For a long time, particularly in Europe during the 1500s and beyond, there was a belief that certain wounds, especially gunshot wounds, were, quote, poisoned. And if the wound was poisoned, the solution was obvious, right? You purge the poison by burning it out. So some surgeons would pour boiling oil into fresh injuries, not because it made sense anatomically in any way, because they believed heat sterilized, sealed, and neutralized whatever toxin the weapon put inside you. So what was the immediate result? Excruciating pain, deeper tissue destruction, and even worse inflammation. And they didn't just injure skin, their methods also cooked muscle, nerves, and blood vessels. And if that does not sound bad enough, the complications were brutal. You see, severe burns create a larger wound surface area, which means more fluid loss, more risk of infection, and higher chance of gangrene. Add battlefield conditions, you know they're not the most sanitary, dirty instruments, no antibiotics, no understanding of bacteria, and you're basically marinating a patient's open injury in disaster. Here's the notable historical twist. A French barber surgeon named Ambroise Paré is famously associated with turning away from this. He reportedly ran out of boiling oil during a battlefield ordeal and decided to use a gentler mixture instead. He then observed that those patients actually did better, less pain, less swelling, and better recovery. Whether every detail is perfectly preserved through history, that remains a gray area, but the lesson still holds. Sometimes tradition just isn't medicine, it's just tradition. Number 3, arsenic as a cure-all. For centuries, arsenic wasn't just a murder weapon in novels. It was a legitimately prescribed medicine. That's because ancient physicians knew it did something, and in medicine, if something is strong enough to cause an effect, people will eventually call it a treatment. Arsenic compounds were used for skin diseases, asthma, and general weakness. In the 1800s, arsenic tonics were marketed like wellness shots. But here's the problem. We now know today arsenic is a systemic toxin. It interferes with cellular metabolism and can damage multiple organs. Acute poisoning can even cause severe vomiting and diarrhea, low blood pressure, seizures, and arrhythmias. As for chronic exposure, that can cause neuropathy, skin changes, anemia, kidney injury, and increased cancer risk over time. And the creepiest part, early arsenic toxicity can look like vague illness, which means doctors could have thought they were treating someone while they were instead slowly poisoning them. As bad as all that sounds, we actually still use a modern cousin of arsenic today, but in a highly controlled oncology setting. A purified arsenic compound called arsenic trioxide is used to treat a specific subtype of leukemia called acute promyelocytic leukemia. And here's the wild part. It works by breaking down the abnormal protein that causes the cancer, forcing those immature leukemia cells to mature properly and then die off. That being said, it does not validate the medieval medicine and beauty treatments that were arsenic as a cure-all. Number 2, insulin coma therapy. Back in the 1930s through the 1950s, if you were diagnosed with schizophrenia or other severe psychiatric illness, there was a real chance doctors would put you through an insulin coma therapy. The logic was that if mental illness involved abnormal brain function, maybe repeatedly shocking the brain into a reset state could improve symptoms. So physicians would administer massive doses of insulin to deliberately induce severe hypoglycemia, not mild low blood sugar. I mean, levels low enough to cause seizures, a loss of consciousness, and coma. And it wasn't a one-time thing either. Patients could undergo this repeatedly, multiple times per week, over weeks or months. Then they'd be brought back with glucose. From a physiology standpoint, this is terrifying because the brain depends heavily on glucose. Severe hypoglycemia is an emergency today because prolonged low blood glucose can cause irreversible brain damage. Back then, however, it was the treatment plan. Complications included prolonged seizures, aspiration pneumonia, neurologic damage, and death. It's not like the patient's body gently goes into a coma. It's a metabolic crisis. Fortunately for us today, insulin coma therapy fell out of favor as better treatments emerged and as evidence failed to support the benefits compared to the risks. And it's worth saying something clearly. Insulin itself is one of the most life-saving medications in human history. This is not insulin's fault that it was being misused. This was just another case of humans experimenting with the brain before we truly understood what we were doing. Number 1, mummy medicine. This one sounds fake, but I'm sorry to report, as a man of science, it's very real. For several centuries in Europe, people believed that powdered human remains, specifically mummified bodies, had healing properties. And the substance was called mumia. It was sold in apothecaries as legitimate medicine. People were grinding up real mummies and ingesting them. Physicians prescribed it for headaches, bleeding, seizures, bruising, stomach issues, even the plague. The belief was that the preserved body contained vital life force, and consuming it would transfer strength to the living, which is a wild leap. Originally, much of this powder came from Egyptian mummies imported to Europe. But as demand increased, supply couldn't keep up. So what happened? Some sellers began using freshly executed criminals. Now, let's talk physiology. Decomposing tissue is not sterile. It harbors bacteria, fungi, environmental contaminants, and potentially heavy metals from embalming processes. Ingesting that can cause gastrointestinal illnesses, systemic infection, or toxic exposure. And remember, this was pre-germ theory. No one understood microorganisms yet. So people were essentially treating headaches with powdered corpse and hoping for the best. But biologically, there is no mechanism where ingesting decayed human tissue transfers vitality. Modern medicine absolutely uses human-derived materials. Blood transfusion, organ transplantation, skin grafts, bone grafts. The difference? Consent, screening, sterility, science. Those were 5 creepy medical procedures from the past that make you appreciate modern medicine on a spiritual level. If you want part 5, tell me in the comments which one made you say absolutely not and which one shocked you the most. And please don't forget to subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.